Since the pandemic, our nation has witnessed an unprecedented spike in behavioral health needs, exposing vulnerabilities in our systems, our communities, and ourselves, and underscoring the urgent responsibility we share to respond with compassion, resources, and real solutions. In California, the trend paralleled that of the nation. Around this same period, more than 284,000 young people were struggling with major depression, and nearly 66% received no treatment at all. And while our state leads the nation in many areas, including behavioral health innovation, California's children, youth, and families continue to face significant barriers in accessing the essential care that they need and they deserve.
The families that we work with, they are amazing. So they come from diverse backgrounds. They're facing their own set of struggles and barriers and challenges.
They're often overlooked and under outreach, and we really just want them to have visibility. We want them to feel seen, heard, and valued.
Coming out of the pandemic and into recovery mode, what we noticed right off the bat is that students were suffering. The trauma that they experienced during the pandemic, the isolation, the social disconnection, and, not knowing where to go to find the help that they need.
We're working with kids whose hearts have been broken, their trust in adults have been shattered. At the grocery store, that kid that's having a tantrum and everybody's looking and pointing might be a child that is in the foster care system or has experienced significant trauma. And we are wanting to be the light and be hope for healing for them, not only just for the child themselves, but also for the families that are caring for them. So it is trauma work. The system itself can be traumatizing to our resource parents and to our children.
To address this crisis, Governor Newsom launched the Master Plan for Kids' Mental Health, a statewide strategy to transform how we support young people by building a behavioral system that is equitable, accessible, and culturally responsive. The Children and Youth Behavioral Health Initiative, also known as CYBHI, advances this vision through programs led by the Department of Healthcare Services and partner state agencies to strengthen the workforce, bring behavioral health services directly into the schools, to develop innovative virtual tools, and to expand services through the use of evidence-based and community-driven practices. As part of CYBHI's investment in scaling evidence-based and community-defined practices, an effort exceeding more than $300 million, approximately 465 grants were awarded to organizations like those represented in this video to expand and elevate this vital work across California.
Hurt people, but healed people heal people. What we found is a lot of times people parent the way they were parented. We're implementing effective Black parenting with adaptations made for cultural specific tools, strategies, and techniques to decrease caregiver and parental stress. One of our participants said for the first time she didn't feel ashamed or alone, and that through our program she gained tools to understand her child's emotions as well as her own. She now approaches parenting from a place of compassion instead of survival.
We need more culturally responsive, trusted messengers in the home visiting role to be able to really uplift and support the communities that we are championing, because there was a critical need to uplift families who were historically marginalized and really truly fell through the cracks in the traditional systems of care. And because we're here now, there's hope.
Approximately 50% of lifetime mental health conditions triggers by the age of 14, and 75% is actually triggered by the age of 24. So those are the opportunities for us to think about intervention. We have a program to really support the students, in the school to address their well-being, a brighter hope and future that, okay, I can get through this. This means I can get through other things.
This is a evidence-based practice that has been one of the silver bullets in addressing the complex needs of children that are in the foster care system, are adopted through foster care. Looking at the whole child, not just behavior, but look at nutrition to help children. We look at the environment, their sensory processing needs, and also building deep connection with our children, learning how to restore trust that was broken. And this grant has given us the ability to walk through that.
We believe that every family deserves to feel supported, seen, and empowered. This initiative really provided a powerful opportunity for us to scale our work, especially with BIPOC communities and marginalized families.
And the success is that in hearing them say yes, allowing us to be a part of their journey, partnering with us, and hearing them say, I'll see you next week.
By embracing and including the students to be part of the program structure as well as development, we were able to reach out to so many more students. We started with 26 students in our first cohort and completing about 151 students through the program.
Success for our community means every child and caregiver has timely access to high-quality, trauma-informed care that addresses their unique needs.
For me, success is community. Community is connection. It is commitment and consistency, but really people just supporting people.
It's the build of an infrastructure, of an ecosystem for well-being, mental health, and physical health for the school community.
It means every family, regardless of background, language, income, or even ability, that they have a seamless access to care, to community, to services, whatever it is that they find value and meaningful for their family. That is success.
Behavioral health impacts everyone.
Everyone deserves access to behavioral health support.
We are every person's community for health and wellness.
A healthy me, a healthy you.
A better California.